When I started my career at Women's College Hospital 25 years ago, the breast cancer genes BRCA1 and BRCA2 had just been discovered. It was revolutionary. We could do a blood test to look for mutations in the BRCA1 and BRCA2 genes and determine if a woman had an increased risk of developing breast and ovarian cancer. And when I refer to an increased risk, it is substantial. For a woman with a BRCA1 or BRCA2 mutation, she has up to an 80% risk of breast cancer. Compare that to the average woman with about a 13% risk. And she also has a 40% risk of ovarian cancer compared to just over 1% for the average woman. In addition, these women who develop breast cancer are diagnosed at a young age, most often in the 30s and the 40s. Imagine what that situation must have been like for these women who we were seeing in our genetics clinic when this testing was first introduced into clinical practice. These women often had a cancer diagnosis themselves, or they grew up in families where multiple relatives had cancer, some of whom may have died of the disease. We could now do genetic testing and tell them what their personal risk of developing cancer was. But what we couldn't do was inform them on how to prevent these cancers or how to treat these cancers if a woman had a BRCA mutation. These were very difficult conversations to have with our patients. We were testing women in our cancer genetics clinics, and we had no research to make recommendations on how women should manage their cancer risks. This then became the mission of our research team at Women's College Hospital. We needed research to inform our clinical recommendations, to ensure that women having genetic testing and being identified as high risk for cancer would have effective options to reduce their risks of cancer or treat their cancers if they had a breast cancer diagnosis, with the ultimate goal of saving lives. We became leaders in life-saving research, which continues to this day. One of the biggest questions at the time was, how could we leverage this genetic information to personalize cancer treatment? That is, should women with a BRCA mutation with breast cancer receive a different treatment than women without a BRCA mutation? So we developed what became the largest known study in the world to answer this critical question. This was 1997, and collecting the data to analyze this very important clinical question took close to 10 years to complete. However, the results of that study revolutionized the management of BRCA-associated breast cancers throughout the world. Our research showed that if you had a BRCA1 or a BRCA2 mutation and were diagnosed with breast cancer, we could now tell you that death could be reduced by 50% if you had a bilateral mastectomy. 50%! By offering a different type of surgery than what would usually be offered, 50% fewer women with BRCA mutation would die of breast cancer. Knowledge of whether or not a woman had a BRCA mutation could change her future and the future of her family. I'm sure you can appreciate how powerful that knowledge is, but we ran into a problem. The problem is that most women who are diagnosed with breast cancer do not know if they have a BRCA1 or BRCA2 mutation. You probably have friends or even family members who have been on this journey, and you know that they didn't have that critical piece of information to make an informed decision about their breast cancer management. A decision that could significantly alter their chance of survival. At Women's College Hospital, we wanted to change that. To us, the real value in genetic testing for women with breast cancer is in women being able to have testing done quickly, at the time of a breast cancer diagnosis, so they could have genetic test results available prior to surgery. We knew the life-saving impact of personalized treatment options for women with a BRCA mutation. So then the question became, how do we ensure women have access to the information they need to make an informed decision? We started a program through Women's where we offered rapid genetic testing to women with breast cancer at the time of their cancer diagnosis. A woman could have her genetic test results back before she had surgery, and she could use that information to make informed treatment decisions. We enrolled over 1,000 women in that study and found that women absolutely use the genetic information to inform their treatment choices. 80% of women that we identified with a BRCA mutation elected for bilateral mastectomy. So I ask you, just imagine the number of lives that could be saved if women had this information, and not just those lucky enough to live in a city like Toronto and have access to genetic testing. We recognized that we needed to increase access to ensure that there was equity in being able to access genetic testing at the time of a breast cancer diagnosis. Why should a woman who lives in a remote area of Canada with no access to specialized cancer genetics program not have access to the same services as a woman who lives in Toronto? There had to be a way that we could remove the barriers to accessing this critical service. In 2019, we started a study to evaluate a new model of genetic testing, a simple spit test. You probably saw the sample test tube in your event boxes. That one small tube has the potential to alter a life by providing potentially life-saving information. A woman no longer had to be able to walk through the doors of Women's College Hospital. She didn't need to see a genetic counselor in person, adding to the number of appointments she would have at the time of breast cancer diagnosis. She didn't have to sit and wait in a blood lab at probably one of the most distressing times in her life to give a blood sample for testing. We would bring it all to her. On the day a woman is diagnosed with breast cancer, she can be enrolled in this study. All information is collected virtually. A saliva sample collection kit is couriered directly to her home. She spits in a tube, ships the saliva sample to the lab, and results are given by phone by our genetic counselor within about 7 days. Women from coast to coast to coast can access this research study no matter where she lives. We are revolutionizing genetic counseling and testing to ensure that women can access genetic testing where and when they need it the most. Women from across Canada can be empowered to make the most informed decision possible about breast cancer treatment. Not only are we testing this new model of rapid genetic testing at the time of breast cancer diagnosis, we are also evaluating population genetic testing. Population testing refers to testing anyone, not just those who have a higher chance of having a genetic mutation. Traditionally, genetic testing in Canada focuses on testing those who are at the highest risk, and as a result, an individual must meet certain criteria to be eligible for genetic testing covered by our provincial healthcare systems. However, we know these criteria are not perfect. We know these criteria are not capturing everyone who has a genetic mutation that increases their risk of cancer. This is a missed opportunity to identify women with an elevated risk of cancer and to prevent these cancers from ever happening. We recognize this missed opportunity, and a few years ago, we launched the Screen Project. Now, any Canadian over the age of 18 can access genetic testing, regardless of whether or not they meet criteria for testing. In the first 2 years of this study, 23% of the individuals who we identified as having a BRCA1 or BRCA2 mutation did not meet criteria for genetic testing. 23% of those tested would never have known that they are at an increased risk of developing cancer. And unfortunately, many of them would have gone on to develop cancer. This was no longer a missed opportunity for them. But the benefits don't stop there. Once a woman is identified with a BRCA1 or BRCA2 mutation, we can then test her relatives to see if they have that same family mutation. Remember, these BRCA mutations are passed down from generation to generation. With every pregnancy, there is a 50% chance of passing on the mutation to an offspring if a parent has the mutation. Being able to test relatives allows these individuals to know if they are also at an increased risk of developing cancer. This goes far beyond just parents and siblings. Think of the cousins, the aunts, the uncles, the nieces, the nephews. They now have the option of knowing if they too are at an increased risk of developing cancer. For those who are identified as having the family mutation, there are options available to significantly reduce these cancer risks. We can prevent cancers from ever happening in these women, all because their relative had genetic testing. Here is our challenge. To reach our goal of reducing the number of women developing and/or dying of hereditary cancer, we need more women to be able to have genetic testing. We need to continue to break down the barriers to access. We need new models of care. We are doing that at Women's with your help. We are committed to ensuring that genetic testing is accessible for those who want to know this information, those who want to know if they have a high risk of developing cancer, those who want to know how to best treat their breast cancers, those who want to know if they can help their relatives also know their risks of cancer. With this information, we can give every woman every chance to prevent and survive cancer. Thank you.